Okay, there we go. So, welcome everybody. I am so excited that you are here. My name is Dr. Melinda Stewart. I am the founder and CEO of Compassionate Navigation, and I am joined by two of my incredible teammates. So, I'm going to ask for each of them to very quickly introduce yourself, and I'm going to pick on Mary first.
Awesome. Thank you, Melinda. My name is Dr. Mary Kira. I am a professor of organizational communication and a consultant with Compassionate Navigation. And as a consultant, I work with individual employees, leaders, teams, and organizations to strengthen communication within organizations and address a wide range of organizational needs that include, but not limited to, effectively onboarding new employees, strengthening team communication, change management, workplace conflict, and work-life balance. And so why I'm excited to talk about boundaries today, because that's one of my areas.
Awesome. Thank you. And our other teammate.
Hi, I'm Dr. Sarah Simons LeBlanc. I'm an associate professor of communication and I focus in interpersonal, family, and health communication. But I'm here today because as a consultant with Compassionate Navigation, I would like to work with patients and some medical providers on how to communicate more effectively so that patients are heard but understand what is being said to them from the doctor's perspective, but also to work with doctors so that patients feel heard and their symptoms are not just addressed symptom by symptom, but that they're seen as a whole person and not just a disease.
Awesome. Thank you. I am truly honored to have known Sarah for a very long time. We were talking about that before we started the session. We think it's been about 10 years. And Sarah introduced me to Mary, and it has just been such a joy to work with them. And as we do the work that we do. So let me start there real quick and just kind of give all of you an understanding. So Compassionate Navigation is a organization that helps individuals, families, and organizations really engage and have effective, difficult conversations. So we do conflict mediation, we do patient advocacy, and we do grief advocacy. And that can be on an individual level, helping different families, or working a lot with what we're going to be talking about today from that organizational standpoint. And so before we really get into this, we kind of have to lay a little bit of groundwork. And I want to make sure that we set the tone and understand that when we think about boundaries, and that's the focus for today's webinar, we want to make sure that we think about the fact that boundaries are not walls. They are ways that we offer clarity, that we can offer compassion, and that we show and give ourselves self-respect. And all of those things are happening in our actions. So when we think about boundaries, we can think about them in terms of personal boundaries, the limits that we are setting to protect our time, our energy, our well-being. We can also think about this in terms of the professional boundaries, the structures that are going to define our roles, the ways that we maintain respect, and especially in the professional side, how we try to reduce and prevent burnout. From a relational standpoint, we can think about this with our friends, with our families, with our romantic partners. And these are going to look like agreements that sustain mutual trust and understanding. So, we do have quite a few people on this call today, and I am so excited to see you all here. So, I'm going to ask that we use the chat real quick. And if you would, I'd love to hear just or see just a few words, if you will. When you think of boundaries, what words come to mind? When you hear the word boundaries, what comes to mind? And if you are not muted already, if you would please do me the favor and hit that mute button so we don't get any weird background noises. Thank you. So, self-preservation. Yep. Respect, don't cross, work-life balance, limits, autonomy, consent. These are great. Line, space, clear expectations, limits for self. Yeah. So these are really, really important to take into consideration that, and I'm loving the fact that we're thinking about this in limits for ourselves, that this is protection, that this is consent, because that's really, really a key aspect for this. So when communication comes into play, and as you might have heard, like all of us are communication professors. I was a communication professor for 20 years before I left academia to do this work full time. And the science behind boundaries really kind of centers on this idea of expectation management and communication clarity. Because poor boundaries are really going to lead to roles of confusion, burnout, as I mentioned, resentment, and turnover. So having clear boundaries isn't a selfish act. It's actually really, really important as we think about how we are managing and working with each other. I am also I don't know how to phrase what I am when it comes to this, but for years, have been deeply fascinated with interpersonal neuroscience and neurobiology and really understanding what's happening in our brains when we're engaging specifically in difficult conversation. And there are decades of really great research that talks about what happens in our bodies. And if you are not familiar with any of this, I do have a podcast called Communication Compass, and I have a few different episodes that you can check out where I talk about some of these things. But chronic boundary violations trigger our body's stress response. So when you are trying to set that boundary or you feel that that boundary is being pushed back, your body naturally starts thinking that you're under attack, which then means your amygdala starts sending all of the hormones and chemicals in your brain to protect you. In other words, when someone comes at you and they cross that boundary or they cross a line with you, your brain essentially kind of thinks of that act as the same as you being attacked by a bear. So your brain doesn't know the difference, which I also think is kind of entertaining. And once we're in that response, our bodies, again, is going to start protecting us. But the most important piece is that if we get flooded, if we get too much of these emotions because that boundary was crossed, the logical part of our brain that would tell us how to step through this, it kind of goes offline. So setting boundaries, knowing how to support them and talk about them in a way that other people don't cross them actually helps us protect our own bodies in a number of ways. But there's a number of different myths that a lot of people have when it comes to boundaries. I'll just give you three. One is that boundaries are selfish, that, we really shouldn't be setting boundaries because that's just us being selfish. Nope, that's self-love, that's self-care. And I am a huge, huge proponent of this, and the science backs it up as well.
You tell by looking at you, chubby.
Oh, please make sure you've got your cameras or your audio muted, please. So we also often sometimes think that good employees or good family members don't say no. That we shouldn't say no. We show that we're really committed to our teams, that we're committed to our families by never saying no. And that is just a direct a direct one-way ticket to burnout. We do have to be able to say no. And it's not just saying no to the things that we don't want to do. Sometimes we really have to make sure that we're saying no to the things we want to do. But we sometimes need to explain why we have to say no. However, I will say that no is a complete sentence, and we don't owe anybody an explanation for when we have to say no. I am a fan of kind of giving a little bit of an explanation, but it doesn't have to be a discussion. If I say no, then it's no. And when I offer that additional expectation to set and make it clear why I've set that boundary, then I can offer that. But if I'm saying no, it's not something that you're going to convince me otherwise of. A last myth that we'll highlight just right for a moment is that if we set boundaries, I'll disappoint everybody. You might disappoint a couple people because, maybe they were really looking forward you to doing that. But in the workplace, as we're going to get to in just a minute, sometimes we're afraid that if we don't say no, or if we do say no, that something isn't going to get done. But we may not be the best people to do it. Maybe we can do it, but maybe we have a lot on our plate and we need to say right no right now. And that is probably going to disappoint someone because it really needs to get done and they don't want to do it. But it also offers opportunities for other people to step up, which I think is important. So when we think about boundaries, I want to highlight what is known as the boundary spectrum. And it's kind of the ways that we can think about boundaries from rigid, absolutely not, this is not okay. I will not put up with this type of behavior. I will not be spoken to this way. These are our hard no's. Like this boundary, you just do not cross. Then we have the healthy boundaries, which are, I've got some room for this. These are the things that I'm saying, no, I cannot do right now because I'm protecting my own health. I'm protecting what's going to be best for myself, my family, my department, my team. And we're really focusing on how that might need to wiggle from time to time. Maybe we can't do this right now because of this time constraint or budget constraint, but in the future, we can revisit that. And then there's the porous. And the porous side of this is, it might depend on the day, might depend on my mood. It might, depend on a lot more. And it's a lot more flexible. And we can revisit that over and over again. And what's important here is that we really need to make sure that we are encouraging self-assessment and thinking about where we fall in each setting given what is going on in that day. So being able to check in with ourselves about why am I wanting to do this? Why am I not wanting to do this? Do I have the bandwidth? Do I have the capacity? Is this going to be really good for me? Do I say no to this strategically? And then how do I give that follow up and that feedback? So, one more real quick from me, chat share that I'd like you to engage in is when we think about boundaries, and we're about to shift into thinking about three kind of main categories of our work life, our healthcare situations, as well as on our interpersonal families, relationships. Which category of your life do you think you find setting boundaries or doing boundary work the hardest? Is it your personal life, your work life, health? Where do you think that you find boundary work the hardest? Lots of personals with your mom, work, 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 work. Yep. Mary, we got lots of people that are going to need your help here in just a minute.
I see that and I'm excited.
Yeah. So we've got a lot of this. And what's interesting is sometimes people are so good about their boundary setting in one aspect, and it's just the hardest thing in the world to do in other areas of our life. So if you fit that category, welcome to the club. You're surrounded by people that also feel the same way. Just because you're good at it in one aspect doesn't necessarily mean that you're going to be great at it in all of these other categories as well. So we do have a lot of people, and the nice thing with this group is we have quite a variety. Some of you are coming to this because you work in HR. Some of you are here because you are team leads and directors. Some of you are coming from medical healthcare settings, educational settings, or maybe you just found this and you're here because you do want help with your personal life. And the great thing is that's exactly what we're going to do. So I'm going to pass it over to Mary and let her talk about boundaries in workplace settings and organizational settings.
Thank you, Melinda. I'm just going to go ahead and set my timer here because there's a lot to talk about with respect to boundaries in the workplace. And I did see on the chat like how many of you this is the category of them. This is the category that you struggle with, and I do too. So let's work through this together. And a great starting point is to understand why boundaries fail within the organizational setting. And there are a couple of factors that contribute to that. Obviously, this conversation alone is not enough to unpack all the factors. I'm just going to touch on a few with hopes that we can build on these conversations in the future. So one factor that contributes to boundaries fading is the ambiguity that characterizes organizations, and especially when it comes to expectations. And I remember seeing in the chat, as some of you talking about when Melinda asked what comes to your mind when the term boundary is said, I did say clear expectations. Correct. And this lack of clear expectations sometimes make employees not know what is enough. So they end up saying yes because they do not clearly understand their roles. They do not clearly understand their responsibilities. So whenever they are asked to do something, they immediately say yes. I experienced this actually last in the spring of this year. I asked to be part of a certain committee, which is part of a professional institution I'm affiliated with. And I remember our first meeting, we were told we need to choose a vice chair. And the criteria is the vice chair needs to be someone joining the committee for the first time. And I was one of those people joining the committee for the first time. And it was interesting how it wasn't clearly communicated what are the roles and responsibilities of the vice chair. We were just told one of the goals of this meeting is to decide on the vice chair. And sometimes because you're like, yeah, if I ask about the roles, I look like I'm pushing back on things. We often tend to say yes in the moment, even though this may not be ideal for us. We already have a full plate. Another factor that contributes to boundaries fading in the workplace is unspoken norms. And I'm sure you've experienced these where this expectation, for instance, to respond to emails promptly or make decisions promptly. And the way this shows up and how this expectation slowly builds within our DNA is I send an email and it is within still 24 hours or 48 hours. Say I sent the email to Sarah, and then I ran to Sarah on the hallway and I'm like, hey, did you have a chance to see my email? And that then Sarah feels like, dang, I am late or like I am really delayed in answering the email. And so we continue building these feelings. And before we know it, we have these expectations of people to be responding promptly to emails. And the same goes for messages. And it doesn't help some phones do send read receipts. And so if you're like, oh, dang, they did send the read receipt and they haven't responded, you feel again the need to respond promptly. Another factor is sometimes the trivializing language that is used when our boundaries are being violated. For instance, you'll get a request which is framed like, oh, I just need you to help me with a small favor. Or this is a quick task. It shouldn't take much time. And then think about it. If it was that easy to do, why did they do it instead of asking you? Why did they spend the time looking for you or writing down that email instead of doing it? But then the framing of it's a trivial task makes us like feel the need again to say yes, because like after all, it's a simple thing. I could just easily say yes and we move on. But again, keep in mind as you say yes, you're pretty much adding more things to your plate and violating your own boundaries. And before you know it, burnout might be a reality of your life, which you hope to not be the case. Again, two quick factors that I'm going to speed through is power dynamics within organizations. There are power dynamics. For instance, people do not occupy the same positions. We do have managers, supervisors, and employees. And employees especially those with less power, often feel the pressure to say yes to everything being asked of them because then they don't want to be the bad books with the supervisors or the management. And I'll also add to that the constant tensions that characterize organizations are another key contributors to boundaries failing. So tensions here is sometimes you'll understand saying yes to something is gonna violate your boundary, but you're also like saying no is gonna make me look like I'm not a team player. I don't care about my colleagues. So when we experience these tensions, unfortunately, our brains in the moment interpret the decisions we have as either or, so yes or no, even though other options exist. And because no, if the no might carry more weight to you because you're then feeling like I'm gonna disappoint my colleagues, it's gonna affect my performance evaluations, and then I'm gonna risk not being promoted. All these factors then make us say yes immediately, sometimes even without considering other options that exist. Just because it's not an yes, it doesn't mean it's automatically a no. It could be you could do that task, but at a different time. But again, in that moment, our brain thinks in dichotomy, either yes or no. And most often we say yes. And then finally is the reward system that favors overfunctioning. So we have these expectations in organizations or structures that tend to reward people who are overperforming, overfunctioning, people who are not having those clear boundaries for themselves. These are the people whose names are mentioned often for promotions or like any rewards within the organization. And that again, what it does is it adds pressure to all employees to do more, even when they do not have the capacity or the bandwidth to do all those things. The impact of these boundaries failing is now decreased trust in the leadership. So think about it. If your manager or the leadership is not communicating the roles and responsibilities clearly, then you're most likely going to start developing feelings of distrust towards them. Boundaries fading also leads to like loss of psychological safety. That is, we no longer feel safe to speak up or express honest thoughts without fear of negative consequences, without fear of, oh, no, my name is not going to be considered for promotion. So these factors again make us, these are the consequences of the boundaries fading that also act sometimes as catalysts for why we say yes. And then finally is again when our boundaries are when we fail to maintain and communicate boundaries within work, then we end up experiencing fatigue, disengagement, and ultimately burnout. And again, that's what we are trying to avoid. So I'm just going to quickly go through some of the strategies that we could implement to be able to set these clear boundaries. Number one is set those upward boundaries with your supervisor, and I will say using clarity and data instead of emotions to explain your position. And I do know Melinda did mention earlier on no is a complete answer, but if you are like Melinda or myself who like to give explanation, that explanation then could entail again using clarity and data instead of emotion. And what this means specifically is, for instance, reference expectations. How you understand them. If your duties and responsibilities are spelled certain way, then say, my understanding is these are the roles I'm supposed to, reference those expectations or what the contract says about your duties and responsibilities as you say no, because then that is going to remind whoever is asking you to do more like, oh yeah, these are the tasks that you're currently working on. And do the same with your colleagues too. So we communicate upwards with our managers or supervisors, those boundaries, we reference data, but also do the same with the colleagues that again, they don't think you're being difficult, but also you, more importantly, you don't think you're being difficult by saying no, like explain to them why you cannot take on a task. And like again, reference maybe the task that you have or the expectations of the team. A few examples of how to go about this, because sometimes when I'm told like, yeah, be strategic, I'm like, I get it, but could you provide examples, like specific examples of how I can be strategic? And that's what I'm about to do in the next minute, which is, for instance, you can say, I would want to give this my full attention, but I don't have the capacity today. Can we revisit this next week? And if next week is also busy for you, you can say, can we revisit this at a later time so that you're not necessarily committing to next week. And next week, again, you're struggling because it's already full. You're struggling to figure out how to fit all the tasks or complete all the tasks. Another example is for sustainability, I keep my work within my scheduled hours. So that's another script you could use to communicate boundaries. Sometimes I also like to frame things in terms of questions when I'm establishing these boundaries. So it could, if you're being asked to do something by, say, your manager or supervisor, you could respond with, I have got 4 other things that I'm working on this week. What would you like me to prioritize this? So you frame it as a question. And then once they say like, I would like this to come at number 1, then you can say, well, I'm happy to do that. I would also like us to be on the same page that I will need to push like now, which or becomes the 5th task to the following week or after that. So that, again, you don't prioritize this task first, but you end up having to do all the 5 tasks in that week. Yeah, so those are just some of the examples. And I would like to end, because my time is coming to an end, I'd like to quickly wrap up by saying that communicating boundaries is you're not being selfish, you're practicing self-care, but also more importantly, you're being practical. because it helps both parties, you and whoever is asking more of you, to understand your workload, because sometimes the managers do not have the granular understanding of your workload or task. So you communicating these boundaries and explicitly stating the things you need to do helps both parties understand the workload. So please keep communicating boundaries because they'll help you show up in your work more effectively. Thank you.
Thank you, Mary. There are so many. I don't know if you can see me in the little window, but I'm like snapping all over the place. And one thing I'll tack on real quick is, what she's really getting at is this understanding of cognitive load, like how much can we actually do? And I don't know about you, but I know I've been in so many situations where the boss or the team lead or whomever is like, oh, well, here's these 17 things that have to be done right now. And they're not thinking about the other 17 things that I have to do. So if you are in that leadership position, I want to implore you, please think about the cognitive load. Let's have this be a conversation, and you can model respecting those boundaries by just starting off the conversation. So tell me what's on your plate right now. What's going on? What are the priorities that you have? Let that person tell you those things, and then you can set that. It was like, okay, so right now I really need you to focus in on this. How can we help you with these other things? So you're setting the boundary of like, this is what needs to get done, and helping that person also realize that they can come to you and talk about, well, I just had this added to my plate. How can I respond back to them? So we can model that behavior. I love boundaries in the workplace setting, so we could just do a whole thing just on that. And if you'd like us to, let us know. We'll happily do that. So I'm gonna talk, we're gonna shift from workplace settings to the place where I think boundaries get the most messy and the most blurred. Because when we are thinking about our family systems, it's not just, well, you don't pay me enough to do this. So my boundary is I'm only going to do the things that I'm paid to do. So I'm going to quiet quit. I'm not going to do those things. We can't necessarily do that with family because with family, we have to take into consideration love, loyalty, responsibility. And I work with a lot of families and patients right now that are having to take care of mom and dad and other family members. And there's some boundaries there. They took care of you, they raised you. And in some cases, it's this expectation that, well, if you loved me, you'd know what I'd need. You'd automatically just do these things. And I don't know about you, but I'm not a good mind reader. I can see some things that need to be get done, and I'm very proactive about asking, well, do you need help with this? Do you want help with this? How can I support you in this? But we can't have this expectation that if they loved me enough, they would know that. So if that's an expectation that you have, we want to make sure that we're letting those people in our lives know that these are the things that we need. Because in their heads, they might be thinking if they wanted help, they would ask. I don't want to breach their boundary by just assuming that they need help with this. We also want to make sure that we aren't falling into the trap of thinking that family always comes first. Sometimes family does come first, and then there's times where work might be needing 90% of my time, and so I don't have all of that extra time to turn to family. The whole idea that, marriages and partnerships are 50-50. That's not real. Like, that can't be real. There are times where in our relationships and within our families, sometimes I have to give 70 because my family really needs that. And then there are times where I have no spoons left. I have no energy. I am sick. I'm XYZ thing. And I need my family to help me with that. So it can't always be that they come first. Um, and we also fall into this horrible feeling of that I can't say no without feeling a great deal of guilt. And there's all sorts of guilt and shame, amazing research that can be tied into this. But sometimes we, like I said, we do have to say no. We have to remember that there is great emotional labor and invisible caregiving that we are giving all the time. And sometimes if we're giving and giving and giving and giving, there's nothing left to give. So we have to fill our own cups. I know this is kind of a cliche saying, it feels like, but if we're an empty vessel, what are we giving other people? So boundaries allow us to take some time and fill our own cups. I'm saying no to this because I need to rest. I need a day off. I need to go outside and enjoy the weather before I live in Michigan and before we get, 12 inches of snow and I'm locked into my house and not, not in front of the sun. So I have to take time for myself so that I can take care of the people around me. And that's what's making this really about safety and self-love so that I can take care of the people in my life. It's not about creating distance. It's not about being selfish. It's about allowing myself to be the best person to help everyone else. So I want to give you three strategies for when we're working with our family. The first is we want to make sure we're using language like I need and I can instead of you should. I get twitchy when people are like, well, you should do blah, blah, blah. Well, you should back off and let me do what I need to do. Like, I hate the you shoulds. Just don't use the you shoulds. So I'm going to say, I can talk about this after dinner, right? I actually just had this conversation with a family member that I'm helping take care of right now. And she's like, you need to call me right now. And I was like, well, I am busy at the moment. I can talk to you about this at 3 o'clock this afternoon. I, and that's it. I'm not going to give an explanation. I cannot talk about that right now, but I can give you this. So sometimes setting that boundary is saying no, but giving them an option of when you can talk about it. Maybe it's you need to process. I'm just going to pretend Mary's my friend, my family member right now, and she comes to me and she says, I've got all of these things and I'm going to upload all of these things onto you right now." And I'm going to, woof, that's a lot. I need a little bit more time to process what you just said. Thank you for sharing that with me. I'm going to need about 20 minutes to kind of process what you're telling me. I just see a note about love this de-escalation strategy. Yes, that's exactly what this is. This is de-escalation. If I responded too quickly, I might say the wrong thing because I'm overwhelmed. So there is such great power in the pause, that space between reacting to what people are saying and giving that response. So I'm going to tell people I need this, and I'm very clear of what it is that I need. And I always follow back. So if I tell Mary, give me a day to talk about this, I'm always going to make sure that I come back and have that conversation at that time. We need to normalize repair and flexibility. We're gonna screw up. We're gonna we're gonna say the wrong things. And how we repair that. If we say no and we disappoint someone, then we might need to do a little bit of repair work. And we need to recognize that boundaries evolve within different contexts. So maybe I had to say no in one thing, and in this different context, people expect that I'm going to say no. And I was like, well, hold on, hear me out. When it came to that situation, I had to say no. But here, this is going to evolve. I'm in a different place right now. I understand the situation differently. So I'm going to give that flexibility, and it's not, and that's kind of where that rigidness versus healthy versus porous. I got to check in with myself and see where am I going. And lastly, I need to reinforce my boundaries. This is going to help reduce resentment and increase respect. People, when you first start setting boundaries, they're not going to like it. They're so used to you always saying yes. They're so used to you always being the go-to person, and they're going to be a little cranky when you start setting these boundaries. And I really hope that you'll hear me when I say this says so much more about them than it ever does say about us. So you are absolutely in the right place for setting that boundary. And, if you've got narcissists in your families, if you've got people that, aren't going to really respect that, take a pause, remember why you're setting that boundary and why it's so important. And this is why having accountability and having someone to vent to and talk to about, like, oh, they're just keep pushing this boundary. That says so much about them. You hold strong because if we don't, and if we just kind of wishy-washy through things, if we're not staying consistent, then we're sending mixed messages and that's not offering that clarity. So we really want to make sure that we're doing that. And when we do, we often really increase respect. If I'm standing firm on this and I'm being able to give that clarity, people start seeing, oh wow, okay, she's really taking care of herself so she can take care of others. She's got a firm foundation. She's standing firm in what she's saying, and they're going to respect that. And that kind of also goes back to the workplace, that if you know what it is that you're doing and why you're doing it, and you can clearly articulate it, you're definitely going to be seen as a leader in that aspect. So a lot of things with family also blend quite nicely into our health settings because we're sometimes those boundaries are how we're setting that with our providers so that we can take care of our families or ourselves. So I'm going to ask Sarah to talk to us about the healthcare settings and helping professions.
In healthcare settings, boundaries are good because they provide a strong framework between you and your providers on how to build great relationships. But establishing those boundaries may take time. Um, because unlike other professions where I see my colleagues maybe 3 times a week, there are some of my healthcare providers I see once a year. So, it and while I would like to be friends with some of them outside of the medical office, I know that's not a possibility. So it is one time a year. I'm not social media friends with any of my medical providers because I'm establishing that clear boundary between who I am their patient, and who they are as my provider. However, as a patient, it does take time to establish that trust and relationship. Uh, so if you start developing those boundaries from the beginning, then that should lead to a great relationship between you and your provider. My current general practitioner, our very first appointment lasted 45 minutes to an hour because he sat down and said, "This is what I can do for you. What would you like me to be able to help you with?" So he in a way communicated, this is what I'm good at. How can I help you? What are you looking for? So we were able to establish those boundaries right away, um, or start a good foundation for good boundaries right away. And I have no problem going to him with even the minorest of complaints because he said, I'm here to help you maintain a healthy life. There are two levels of boundaries formations in the healthcare setting. There is that side from the medical professional side. They did go to school for many years to become a doctor. They did take many courses and do many practicums to become a nurse or a nurse practitioner or a physician assistant. So, yes, they have the knowledge, but they were also trained how to create those boundaries. I am the one who knows this. You're just the person in the bed right now or in the chair right now. So, in a way, we need to retrain our medical professionals on how to use communication, both verbally and non-verbally, to create healthier boundaries between them and their patients. There's also the patient side of creating boundaries. Ask yourself before you go in, what are my boundaries? What am I willing to share, and how much am I willing to share of that? Um, for example, because I've had a lot of medical appointments this month. I had one yesterday with my obstetrician, and I have established the boundary that I will update her on what's going on with my uterus part of my body. But also, because she was my obstetrician when I was pregnant with my second child, I also give her updates on how that child is doing. That's it. Those are my boundaries. Those are two areas that are safe. Well, actually, there's a third area of my research because I study a lot of menstrual communication and menstrual education. Sometimes self-disclosure between both of us will occur during those appointments, but it always deals with what I'm researching at that time. But I'm establishing those boundaries because I think about it ahead of time. I think about how long I've been with this doctor and what topics am I comfortable discussing with that medical provider. Uh, I tend to talk fast and lose my thoughts. But there are often boundary violations in the healthcare system because they're often systematic, but it's not because of an individual failure. Many people are often overworked. They have an unrealistic patient to ratio, and there's a lot of moral distress going on. I can't imagine what some of these doctors and nurses or nursing assistants see in a day. I know what I experience as a professor sitting at my desk and getting stories from students, but I can't imagine doing that on a day by a 12-hour shift in a setting. You also get the emergencies that come in, and this will often lead to compassion fatigue or even, oh, I become the caregiver identity trap. Um, Checking in every 2 hours to make sure the person is okay. What's interesting to note is how much these boundaries or these boundary violations will differ depending on the age of the patient. St. I found an article put out by St. Jude that says a lot of the nurses and staff that care for sick children often establish really tight relationships with family members of the patient they are treating because they are there on a daily basis. But they also need to be aware of what they are sharing about those patients. So they can't necessarily take these patients home with them, but have to leave them at the door. But sometimes they want to be able to share that information on social media. But sometimes those social media posts will either violate the patient's confidentiality or make the staff look bad. A couple of months ago, there was that video of, I want to say, OBGYN staff posting videos of what some patients left on the paper on the exam table. And I have to ask, did they violate patient confidentiality or did they violate boundaries established between the staff of that medical establishment and the patients that they treat? We also, as patients, and even our families and colleagues, will often project emotions that will blur professional limits. Um, so there are some strategies we can do to sustain care and to establish healthy boundaries between us and our professional healthcare providers. One, which you have heard, is the pause practice. Take one deep breath before you respond to boundary violations. The second thing is to use emphatic but firm language. I understand this is frustrating. Here's what I can do for you right now. That is a good example of what a medical provider can say to a patient. I can't give you a clear diagnosis right now, but this is what we can do until your test results come back in. Or if you don't mention a problem during the visit with the nurse before the doctor comes in, they might respond with, I want to give you my full attention, but I can't promise you more than 5 minutes to discuss this issue. We may have to schedule an additional appointment. Or I want to give you my full attention, but I need a moment to review your chart. As somebody who often gets frustrated waiting in the exam room, I am now starting to realize that between the time the nurse leaves after doing my intake and the doctor comes in, they have spent time reviewing the notes that the nurse had just taken. They need those moments so that they can come in and we can have boundaries established right from the beginning. So, other things to keep in mind, especially if you're an employee in a healthcare setting, is to decompress at the end of the shift. Take a few moments. I'm a fan of this because I thought of this during Mary's talk, is I like having a long commute so that I have time to take off one hat and put on the other hat so that my boundaries are established. So I'm not complaining about work in front of my children, and I'm not complaining about my children and husband in front of work. So take that time for your ride home to decompress uh, before entering into another situation. And also use handoff language that signals an emotional closure. So and so is a tough patient today, but if you take a breath before you go into their room and take another one when you come out, it'll be easier for you to handle. The last thing I want to stress is that boundary setting protects both you as a patient and the provider and what outcomes may come about. One more thing I want to stress, because I meant to put this under emphatic but firm language, is as a person who studies menstrual communication, a lot of the research will say that patients receive the phrase, that's normal. So they feel like they're being dismissed and that the boundary that they want with the doctor is not even being approached. As a patient, we would stress, I understand you believe that's normal because that's what all the research has said, but you need to understand that's not my normal, which shows that A, you were listening to what the provider said, but B, you want to be heard a little bit more than just beyond the word normal. So with that, I'll pass it back to Melinda.
I absolutely hate that phrase of like, oh, well, that's normal. No, what you've just done is you've medically gaslit me. And
Mhm.
that's not okay. In fact, I believe Sarah and we've talked about this, and I think we're doing this in the spring. We want to do a whole webinar called That's Not Normal, where we're going to talk about some of these things, especially from a women's healthcare perspective, about the things that we are told are normal that in fact actually can be signs of not normal. And I love your example of saying that's not normal for me. You know, that may be normal for lots of other people, but that is not normal for me. So we've got a little bit of time, so I put a question, I put a comment in uh, the chat. If you have any questions for us, we would love to be able to answer a few of them. If not, I have a plan. So, but do you have any questions for us on these boundaries? Is a women's health seminar have a date yet? What was the month you said? Was it March or May?
May,
So that's about all we got so far is we're going to do that in May. All right. So as questions hopefully come in, I'll just ask our participants. So if you were going to give one little end all be all nugget of truth, what would you like to leave our audience with today? And we'll go in reverse. So I'll have Sarah go and then Mary, and then I'll close us off.
I actually packed an answer down sometime.
Okay.
Um, from my own experience as being a patient, uh, I need to understand, I need to listen to myself, but I'm also my only advocate. That's something I learned during my first pregnancy. True story, I was left for 2 hours in an exam room waiting for the doctor. It turns out she was called away for an emergency delivery, and nobody in the office came and told us. I felt like I was sneaking around, even just having to use the bathroom because you don't leave a pregnant woman in an exam room without access to a bathroom. But it was recalling that incident when I wrote about it that I realized I can only advocate for me, and the baby that's not even born yet doesn't have an advocate. I'm their advocate. So you have to be your own advocate because in a healthcare setting because you are the only person who knows your body. They know the research. You know your body.
I
So
always call that
self-care.
I'm the CEO of my body.
Yes.
I get to control and know what's going on, and I'm the most intimately aware of what's going on. So I'm the CEO of my body, and that means I have to push back and set boundaries. Then by gosh darn it, I'm gonna do it. Mary, what are your thoughts?
Yeah, the strategy of pausing and reflecting that has been discussed by both Sarah and Melinda do apply also in workplace setting. So my final takeaway would be before saying yes, pause and reflect by having a conversation with your future self.
Mhm.
Specifically ask, will my future self be glad I did this? Or will
Yes.
I be stressed and exhausted? If the answer to that is you probably regret it, then that's a sign you should say no.
Mhm.
I know we've also shared strategies on how to set those boundaries, but also emphasize within the organizational setting, knowing what to say is important, but also knowing what to not say is equally important. What do I mean? Do not apologize for setting the boundaries. Don't go saying like, I'm sorry, or I apologize. No, set those boundaries, stick to them, and enforce them.
Mhm. That's true leadership right there. If you are having to over explain and apologize, no, that's not clear leadership. So being able to set them and stand by them, oh, I love that.
Well,
Um,
Mary and Melinda, since you're the organizational experts, we do have a question that asks, what is the best way to communicate the need to set healthy and appropriate boundaries between managers or slash supervisors and their employees?
I'm gonna let Mary start that one.
Um, so what is the best way to communicate the need to set healthy boundaries? So I'm going to tackle this from the perspective of the managers or leaders, and then maybe Melinda, you can come in from the perspective of employees. I will say as a leader, and I think Melinda mentioned this earlier on, model the behavior that you would want, like model the balance yourself with the employees, um, so that when you also encourage them to set those boundaries and communicate clearly, it doesn't look like you're preaching water and drinking wine. It is actually consistency between your actions and what you're asking them to do. Another way is as leaders, encourage open communication with your employees, with your supervisors under you. Um, and also more importantly, communicate, like encourage open communication so that if people have other tasks they need to attend to, they can openly talk about that with you. But also more importantly, listen and validate genuine concerns instead of saying we encourage open communication, but when that happens, then we tend to label these people who are speaking up as difficult employees or as troublemakers. And also, as leadership, build systems of fairness. In other words, if our if our policies, our documents say um promotion is based on like these performance metrics, let's stick to them and not use over functioning as just a random um criteria for promotions.
Mhm. I like that. That's good. From an employee side in setting boundaries, the things that immediately come to mind are first and foremost, know what it is that you need. Like have some time ahead of time, not just going in and saying, "Oh, well, I think I need this," or "I'm really frustrated." Like go in having done some of that pre-self-assessment and what is it that you need, be able to articulate what that would look like from a leadership standpoint. When anyone would come to me and they're like, well, this is what I need, and maybe I think that that isn't very clear, my first question back is, so what does that look like for you? What does that support look like for you? But if I can answer that for myself and go to my higher up or go to my manager or whoever, say, this is what I need, this is why I need it, this is what it might look like, and then ask that individual, how might we be able to make that possible? Open that up for some collaboration. And so I've got 18 projects. I need to know what these priorities are from your perspective. And I want to, do the best thing that I can. So who all could we get involved? How could we get that help? But know what it is that you need, be able to articulate why you're setting that boundary or why you're asking for that boundary to be set. And then there is that little bit of flexibility of like, how can we make this happen? But we've got to do some self-assessment before we go into that workplace. I see another question here. What is the best way to set boundaries with an X at the workplace? Woo! We're blending two big categories here. First, just don't date people at the workplace. Um, I mean, that's just my own very flippant response. Um,
That was
but
my first thought as well, but it does happen.
it happens so often, and it does, and this is why we so quickly say, well, just don't do it because it gets complicated. Um, Thoughts? I'm gonna open it to the team. Like, what are our thoughts on the best way to set boundaries?
The boundaries actually probably need to be set before you start dating.
Yeah.
So what happens at work stays at work. What happens after work stays away from work or before or after work. Because then if you do break up, Yeah, they're going to know about some of the skeletons in your closet, but they've known since the beginning that those skeletons need to remain outside of the workplace. And if one or both of you try to or approach violating those boundaries, find a polite but simple way to remind them, hey, that is something we discussed. And I just want to remind you that stuff that happens outside of the workplace should remain outside of the workplace.
Yeah, that's exactly what I was thinking is like if you've broken up, hopefully there's at least some still ground for conversation about these are these are what we're going to need to do at work and the feelings and aspects, if you're able to have that healthy conversation of, hey, whatever happened with us is past. We need to be able to work together. Here are my expectations for what this is going to look like from here on in. Mary, anything you want to add?
Yeah, the only thing I would add to that, which ties back to something I said earlier on, which is use data to set those boundaries or use the expectations within the workplace. So I would say for this one specifically, I would use professional expectations as my data to set those boundaries. Again, kind of building on what Sarah and you Melinda already said. Again, is now drawing those professional expectations, like how we expect them to interact professionally. It's not what is happening here, and now use that information to set those clear boundaries.
Absolutely. And as we're finishing up, I'll add the one little main nugget that I'd like to help everyone takes away is you don't have to do this alone. Setting boundaries, especially in the beginning, can be really complex and complicated, and it's going to make you feel all sorts of feelings. Like you're going to feel this in your body. It is going to be sometimes really easy and sometimes super challenging. So you don't have to do this alone. And so my big piece of advice is identify people in your life that can help support you, that can also hold you accountable. I have a colleague that I used to work with at a university, and she was a people pleaser. She said yes to everything. And as somebody who was a few years older in the system from her, I was like, you need to start saying no. You need to start setting some boundaries. So I sat with her and we identified, okay, these are the things that you can and should say yes to. And everything else, when you start feeling that pressure that you should have to do this because you're a junior faculty member, I would literally poke her anytime she looked like she was about to say yes. And I'm like, no, 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 no. We set that boundary. We're not going to get pressured, peer pressured into doing that thing. So if you're struggling with making sure that you can stand up for those boundaries, have someone in your corner that can help you with that. Um, and also, we are here to be your helpers. So if you contact us at info@compassionate navigation.com or you go to compassionate navigation.com's website, you can set up free consultations with any of us, and we can talk you through and talk about how you can set these boundaries specifically. You can give us examples of what exactly is happening in your context in your life, and maybe you're great with the workplace stuff, but you need help with the family. We can do that. Um, so we are here to help you, even if it's just a one-off talk through it. But also, if you are in a position where we can offer training to your staff, to your leadership, that's one of the big things that we do at Compassionate Navigation is come directly to you and help you with that. I'm going to finish this up because we are right at 1 o'clock. You will be receiving a few emails from us with some additional tools and resources, as well as this video. In the meantime, if you have any questions, if you need anything, we are here to help. And we just want to help you communicate better and tackle those difficult conversations, and most importantly, set and maintain those boundaries. Thank you so much for your time today. Thank you so much for Sarah and Mary for joining me on this. Your insight is so incredibly valuable, and I absolutely love having you on the team and working with you every day. So thank you for all that you do. I really appreciate you. And yes, let us know if you have anything. I know Mary's got to bounce to get to class, so we'll see her. I will stay on for a little bit if you have additional questions. And again, just thank you so much for attending today. Take care.
Thank you and bye all.